Hello, my name is Dr. Stefan Tóka from the Dentalklinik Dr. Tóka in Sopron in Hungary. Dear patient, we have received all the CT scans from the UK and we put together different kind of treatment plans for you. In this video I would like to show you the three-dimensional planning of implant placement, and also I would like to tell you something about your teeth and the situation that is inside your mouth right now. Let's go to the first picture here. In this picture, let me make it a little bit bigger for you. In this picture you can see a three-dimensional reconstruction of your upper jaw and your lower jaw. Some of your teeth I have marked orange and some of your teeth I have marked red. Let us concentrate on your lower jaw first. Okay, let us see. This here is your left side, and I have marked these teeth here in the back red because they don't have any prognosis anymore. Yeah, they need to be removed as soon as possible. As you can see, when I tilt this picture a little bit, this is the bone. Sorry, this is the bone here, and these are the teeth. And your teeth here in the back, they don't even have any connection to the bone anymore. They're basically floating in a chronic inflammation here, and these teeth have to be removed as soon as possible. Okay, you have quite big bony defects here already caused by the inflammation, and if these teeth don't get removed as soon as possible, these bone defects caused by the inflammation will get bigger and bigger. So my recommendation is let's remove these teeth as soon as possible. On the other side, the situation is similar, not quite the same, but very similar. I have marked these four teeth here red also because there is a chronic inflammation here inside the bone. You can see these are the roots. They have hardly any connection to the bone anymore. The bone used to be around here. Yeah, if you follow my cursor, it used to be around here. Now the bone is all the way down here. If I make the bone see through, you can see it's only just the tip of your teeth here standing inside the bone. Very bad prognosis. We cannot save these teeth anymore, and putting any crowns or any other construction on top of them would be a bad investment, because I'm pretty sure that you're going to lose these teeth in the next couple of years, and you would have invested in teeth that don't have any chance of survival. So my recommendation is, let us remove these teeth. It's time to say goodbye, and let's see what kind of reconstruction we can do. If we look at this situation now, you have some teeth here in the front, and also on the left side you can go all the way to the back. Yeah, we have here, this is a tooth number 5, you have here until tooth number 5, and usually we reconstruct teeth all the way up to tooth number 6. On the other side you have tooth number 4 here. Yeah, 5 comes here and 6 also here. So there you have one treatment plan which Kata will explain to you, Catalan Price. One treatment plan suggests that we put crowns on top of all of your teeth in the lower jaw and make a cantilever towards the back. Yeah, cantilever means that all these teeth will be connected with crowns. What crowns are, Catalan can tell you exactly. And then we will basically hang one tooth here to connected to all the other crowns here towards the front, which means you will have an extra tooth here with no additional surgery needed. That is one option. Crowns on all of your teeth here and a cantilever towards the back to make a bit longer, row of teeth. That is one option. There's another option here for the lower jaw, which includes implants. If you would not like to have crowns on your teeth here in the front, then we can basically make a reconstruction of this side. Yeah, this is your right side, with implants. And that's how it would look like. Not exactly. I don't know why my program just put so many implants in there, but let me just check. Okay, here we go. That's better. Okay. What I wanted to show you is that we planned 2 implants here in the back. There's one nerve going through your bone, yeah, all the way up here, which we have to consider when we place implants. Implants are small titanium screws that are placed inside your bone in a small surgical intervention. And after we have placed the implants, we give those implants some healing time, something between 2 to 4 months in the lower jaw. After the implants have healed in, 2 to 4 months after placing the implants, you come back to us, we make some prints, and about a week later we have finished crowns that we can place on top of the implants, and we can place 2 teeth here towards the back so you could chew on this side again. So that's the plan for the lower jaw. Okay, so let's have a look at the upper jaw. First thing I would like to show you is the position of your teeth. You can see that your teeth, and I'm pretty sure you saw it in your mouth already, the position of your teeth has changed over the time. I don't think they have had this strong inclination towards the front before. What happened here that because of a chronic inflammation called periodontitis that you have in the upper jaw, a lot of the bone holding your teeth in the upper jaw inside your mouth has gone back, and you can also see here that again the situation is quite similar to the lower jaw. It's only the tip of your the roots of the teeth you have in the upper jaw are still standing inside the bone. The bone used to be all the way up here, yeah, all the way up here. And I'm sure quite a couple of millimeters have gone back already, and these teeth in the upper jaw don't have a good prognosis anymore. Okay, what I'm trying to tell you is that if you think about making a real reconstruction of everything inside your mouth, my recommendation would be to remove all the remaining teeth in the upper jaw. I know it's quite a big step and quite a big intervention, but placing any overdenture or any dentures or any crowns or bridges on these teeth would not be a good idea, because I'm pretty sure you're going to lose these teeth in the next couple of years, and again you would have invested a lot of money in a situation in teeth that just are not going to survive that long anymore. Okay, so my recommendation is we remove the teeth in the upper jaw, and there are a couple of options to reconstruct the teeth here. One is obviously a removable denture. I'm pretty sure you already know how those look like. Catalan can tell you all about it. It's a removable denture with no implants. It holds with suction inside your mouth. Some people can live with it. Some people find it very uncomfortable. It's a matter of personality if you like that or not. It's also a very cheap option. The other option I would like to tell you about is the best option. Yeah, we're talking about the easiest option and the best option. The best option would be to place implants inside the upper jaw. And I'm talking about 6 implants. Okay? As you can see here, 1, 2, 3, 4, 5, 6 implants. You still have some bone left, okay? It's not very much. We cannot place long, big implants. We have to choose smaller, thinner implants. But we can place 6 implants in your upper jaw. And then we have to wait a certain time. Yeah? In the upper jaw, it's a bit longer than in the lower jaw. It's something between 4 to 6 months we have to wait, so the implants can heal in. Over that healing time, you will have a removable denture. It's a temporary removable denture. It's not a very comfortable time, but we have to wait because we cannot put any load on these implants before they have completely healed in. And the upper jaw is simply a little bit different than the lower jaw. It takes a longer time for the implants to make good contact with the bone so they are completely healed. There's one thing though I have to tell you about. If we look at your upper jaw from the top, you can see this here is your nasal cavity, and this here and this here is your sinus. If we place implants here in the back, and we have to place implants here in the back because that's where usually you would chew, yeah, in the lower part, in the back part of your mouth, we see that if we place an implant of 10 millimeters up there, you can see that the implant goes all the way inside your sinus, which is obviously not too good because the sinus is filled with air and the implant would not hold inside your sinus since it does not have any connection with bone. So that means we have to make a little bone augmentation. That means that we make a little bit of a window on the side inside your mouth, a little window towards the sinus, and put some bone augmentation material to the place where we would like to place the implants. Yeah, just it would look like this. We would make a sinus lift, it's called. Yeah, sinus lift. We lift the bottom of the sinus so that we can gain more bone, so that after the healing time of 6 months, yeah, you can see now the tip of the implant is inside the bone augmentation, so that after the healing time of 6 months, the entire implant is inside your bone. This bone augmentation will be converted to your own bone by your body, and this way we can basically create bone where we didn't have any bone before. It's we have to do that on both sides, left and right, because there is just simply not enough bone to place implants so far in the back in this situation. Okay, but it's no problem. This is all something we can create. It would be made in one operation. Okay. Depending on the situation inside your mouth, depending on how your teeth look right now and how bad the inflammation is. Sometimes we can remove the teeth, place all the implants, make the bone augmentation in one step, but sometimes we have to remove the teeth, wait for 2 months, and only after 2 months healing time we can place the implants. During the healing time, obviously, we would have a temporary denture, and then when you come back, we place the implants, and you would still have the temporary denture for 6 months. So in case we have to remove all your teeth, wait and place the implants later, the entire treatment would be around 8 months. Yeah, quite a long time, but it is also quite a big reconstruction. Okay, about the kind of overdenture, the denture that I'm planning here, Katalin can tell you everything about. We're also making a video of it. It's basically a titanium bar that is fixed and screwed to the implants, and on top of this titanium bar will be a fixed removable denture. It's called fixed removable because you can remove it. It has locks on the side that you can open with a little pin. Once the locks are opened, you can remove the denture, clean it outside your mouth. You can clean the titanium bar with a toothbrush, and after you have cleaned everything, you can put it back inside your mouth and lock the pins, and it will not fall out anymore. Yeah, it's completely fixed inside your mouth. It doesn't move, it doesn't fall out. You can smile, you can chew chewing gum, whatever you would like to. Okay, all right. There's a third option for the upper jaw where we place only 2 implants. Make a removable denture, just like the first option I told you about, a removable denture, and 2 of those implants have little retentions. Yeah, they're alpha lock retentions. Katalin can tell you about those as well. They are like little you have something like this on your jacket. When you close your jacket, you have these little pins that you can push together. Yeah, and then the jacket keeps closed, and you can basically, that's how you can imagine it. Those little pins are placed on 2 implants in the lower jaw, in the upper jaw, and you could place the denture inside your mouth, and it doesn't only hold with suction like the first option, but it also holds by 2 implants. Okay, that's your first video. If you have any questions, you can talk to Katalin Price. If she needs some information from me, she will let me know. If I have to do some more explanation in this video, I can make you a second video. If you have any questions, just let me know. Okay, thank you for listening, and bye-bye.